Welcome to another interesting video. In this video, we are going to learn about the menstrual cycle, its normal phases, abnormal cycle, its causes, and some Ayurvedic medicines to help you in regulating your cycle. In our busy lives, we always try to give time for our physical fitness. We learn different exercises and eat healthy food to achieve that specific body. As a female, we have to keep watch on our internal organ functions, such as menstrual cycle, which is important part of feminism. So without further ado, let's dive straight into the video and have a look at what is a menstrual cycle, when and why it starts, and when it ends. The menstrual cycle is the cyclical bleeding, due to shedding of the most internal layer of the uterus and hormonal changes. It starts between the age of 11 to 15 years, called as menarche, and ceases at the age between 45 to 50, called as menopause. As we can see, everything occurs in stages. Well, menstrual cycle is also not an exception for that. Let's see stages of menstrual cycle. There are 4 phases of menstrual cycle, and here is the phase 1. In this phase, endometrial regeneration starts, which was degenerated in menstrual phase. This starts before menstruation ceases, and completed 2 to 3 days after end of menstruation, with size 2 mm. Phase 2. From 5th to 14th days, that means until the ovulation day, the endometrium keeps growing to become 10 to 12 mm thick. Endometrial blood supply increases. These changes take place to prepare endometrium to grow fertilized ovum. Ovulation takes place on the 14th day of cycle. Phase 3. In this phase, if ovum remained infertile, the endometrial growth ceases 5 to 6 days prior to menstruation. Regression leads to next menstrual cycle. Well, what is the importance of these phases, and why every woman should know every phase? The first and most important cause is to track ovulation, and eventually to get conceived. And secondly, for contraception, which also very important. Along with the ovulation test, cervical mucus test is also helpful to help you track ovulation. The first type of mucus is appeared just before menstruation. Slightly damp mucus secreted following your menstruation. When one of your ovum fully matures, then sticky and creamy mucus secreted. After ovulation, this mucus appeared as like a egg white. These are your fertile days. Another symptoms are abdominal pain on either iliac fossa, and slight vaginal bleeding. There are many disorders related with menstrual cycle, out of which dysmenorrhea is common disorder, which means painful menstruation. There are 2 types of dysmenorrhea, that is primary and secondary. Primary dysmenorrhea is found in the adolescents, not related to pelvic pathology. The pain starts with the onset or just before the menses. Pain is confined to the ovulatory cycles. Secondary dysmenorrhea is related to the pelvis pathology, found in elderly or porous women. Pain starts 7 to 10 days prior to menstrual cycle. You must be thinking now, what can we do to have less painful menses? Well, the answer is pretty simple. Yoga and some remedies could solve your problem for longer period of time. There are some plants and fruits that would help you in it. First plant in this list is Saraca asoka. It is really helpful to treat all kinds of disorders related to the female reproductive system. Its bark stimulates the uterine tissues. You can boil its bark in a cup of water and drink daily to get regular menses. It also helps to reduce excessive bleeding during menses, and reduces pain. Next, cinnamon. Cinnamon could be very helpful in managing pain, if used during menstruation. Cinnamon tea is popular form to use it. Glycyrrhiza glabra is another plant having great effect in relieving pain. It has antispasmodic, analgesic effect which help to relieve pain. studies have shown that ginger have great effect on relieving menstrual cramp by inhibiting prostaglandin production, which is responsible for uterine muscle contractions causing pain. Apart from some remedies, regular practice of yoga will be helpful. Yoga is time-tested traditional exercise to relieve stress, anxiety, and help to regulate normal body functions including reproductive system. Let's see which yoga poses have effects on female reproductive system. Dhanurasana is also known as bow pose. To perform this asana, lay down on mat with stomach touching mat. Spread legs apart and hands along the side of the body. Bend your legs, and by holding ankles with hands and inhalation, lift chest and lower body up from the floor. To release this pose, with slow exhalation, put lifted body down. Ustrasana is also known as a camel pose. To perform this, kneel on your knees, with legs apart in a line with shoulders. Keep your hands on hips. By inhaling, bend backwards and hold heels one by one with hands. Hold this position for a minute. Then relax your hands, support your back by placing hands on hips, and release your pose. Baddha Konasana is also famous as a butterfly pose. To perform, sit on the floor with legs folded and soles of legs facing each other. Hold the soles in this state with both hands. Keep your back straight while performing this pose and breathing normal. Bhujangasana is also known as a cobra pose. Lay down on the mat with stomach touching mat. Put both hands along the sides of shoulders. With the support of hands, lift up the chest with inhalation. With exhalation, release this pose. That's it for this video, guys. See you in the next video. And don't forget to try these yoga poses to have a happy and painless periods. Do not forget to like, share and subscribe to our channel. Thank you for watching this video.